Welcome to the Prime Health Podcast with your host, Dr. Dydyk Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Dydyk Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, I want you to think about this. We live in a system built around fixing problems after they show up. And today's guest, Dr. Alexander Dydyk of the 3 Pillars of Health, is rewriting that story by helping people build strength from the inside out by aligning their mind, the body, and a deeper sense of purpose. And just like you, I'm excited to learn more about it when we get to them. So just a quick heads up here as a message from our sponsor, Growth Solutions, where we believe every healthcare professional deserves an exceptional growth partner to match their ambition and reach their potential. And Growth Solutions eliminates stressors in business such as new patient or client acquisitions, marketing and growth strategies, reducing operational chaos and proven systems, frameworks, SOPs, and then understanding which AI systems and agents could be implemented in your practice and your business, because the bots are coming, whether we like it or not. So Growth Solutions is not an agency or vendor. We are your growth partner. So if you've ever thought or said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Drop the word grow below or feel free to reach out to me on any social platform. But you're here for a reason today, and that's to hear from Dr. Dydyk. Dr. Dydyk, again, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Well, Dydyk, thank you so much. I appreciate you having me on the pod. I started 3 Pillars of Health with a platform that allows me to kind of reach out to my community. I'm a doctor. I take care of patients. My primary specialty is interventional pain, but we do a lot for wellness, including kind of weight loss and hormones. And part of that is we understand that when we are in the office setting, we are taking care of patients for the specific problem. Could be knee pain, could be back pain, could be for weight loss, but we don't really get to the root of it a lot of times. So I created a company that allows me to kind of step outside of just that kind of barrier between being a doctor and a patient a lot of times that we see. And we want to really kind of focus on, I say mind, body, and purpose, but another way I look at it is where kind of medicine kind of meets meaning. My goal is not just to be just an advocate for my patients, but I can be a coach. I can be someone who really kind of helps them on their kind of life journey. And I think that's really important. And we want patients to feel that they can get better. I think one of the strangest things about being in practice that I've learned is patients often aren't motivated to get better because they don't see a path for them to get better. So it's not as simple as kind of giving someone a pill or a prescription or a treatment plan. I could have the best treatment plan in the world, but if the patient doesn't believe it's going to help them, then they're going to be stuck. And so we want to be able to kind of help the entire person. And so that's where kind of this kind of holistic and broad approach where my background and training can kind of blend the two of my medical practice and then my platform at 3 Pillars of Health.
Yeah, I love it. It's great because the way you've been trained in modern medicine takes care of, interventional pain and what you do, but you are trying to help that person at a functional internal mode, mindset, body set, functional components. So I can't wait to learn more about the 3 Pillars of Health and how you go through that. So thank you very much for sharing that.
Absolutely. Thank you, Dydyk.
Yeah, absolutely. So I do want to ask everybody, was there a moment in life that said, you know what, I do believe I want to choose a career in medicine? What was that for you, if there was one?
Well, I kind of was always on that path. It's funny. I'm 37 years old now, and at first you kind of say, okay, I was pre-med in college, and I kind of moved my way kind of through, and you kind of take an MCAT, and it's almost like you kind of found yourself on this path without kind of really thinking too much about it. I grew up in one of those households where I was always kind of taking care of my kind of family and friends, and then it became this, you'd be a good doctor one day. But then now kind of looking back and reflecting upon it, I think there's things that I like a lot in terms of the challenge that it presents. Obviously, I'm very kind of people oriented, and that's something that is important. But I talk a lot about purpose and responsibility, and I've always gravitated towards things that have tremendous impact on people's lives. there's no doctor in my family. I'm the first one. And I think that's also kind of interesting when I look back. But I have a lot of people who are in kind of customer service, and a lot of people who I'm half Italian. I've got a big family, and it's all about kind of taking care of people. And I think that's the kind of stuff that I gravitated towards. And whatever career I was going to choose was going to be something that moved me towards that kind of feeling. So it's more of a feeling, honestly, than a career path. And now I look back and it kind of all, you can see all the dominoes and all those pieces kind of fit together. But at the time, it's kind of this kind of zigzag kind of path kind of going through it.
Yeah. So from what I've read about you and kind of watched some of the videos and the stuff that you do, you are, if I'm correct, double or triple board certified?
So I'm board certified family medicine, sports medicine, and pain medicine. And I'm also then got boarded in obesity medicine as well. So we're trying to kind of take care of the whole person. Not every hammer needs a nail, even though I'm full surgical in terms of the things I do. I do stimulators and pain pumps and minimally invasive spine, but also I take care of autoimmune disorders. I take care of pain disorders like fibromyalgia. And so we see patients, and then the other components of their health obviously matter quite a lot. Their chronic disease, I take care of hormones, for example, or obviously patients' weight becomes a huge kind of factor. And so we don't want to just kind of take care of the symptom or the body part, but the entire person. And that's where kind of the 3 pillars of health part of this kind of extends into, because there's only so much time in the office space, right? And so how do I kind of build a community outside of the office, right? And, it's HIPAA compliant and all these kind of things where we want to have a vision of patients, have a place to kind of turn to. It's not just life advice. It's really kind of helping them reach their goals and desires. And I think what I've always taken away from my medical practice is the most important thing in the patient is the most important thing to me.
I like that. That's excellent. I would have to say, how many interventional pain specialists are out there that have made that, post-practice shift or internal practice shift like you have? I can't imagine there's a lot.
No, there's not a lot. And I think everyone's different, right? I think my background was in primary care. And I always liked having longitudinal relationships with patients, right? So I like being able to be their doctor and you get to take care of them. And when you go into medicine, you have this idea that you're going to be their doctor for the rest of their life. And I always liked that idea. And, it's not surprising when I did decide to specialize. I had a specialty that also had kind of ongoing relationships with their patients. There's less of those specialties than I'd like. And, what goes even a step farther with that is when you're in something like interventional pain, it's a very kind of procedural heavy specialty, which is good because you can do a lot of good and kind of fixing problems for patients. But you then sometimes lose a lot of that kind of human relationship that you have with patients. And so in my mind, we were saying as my kind of practice from a surgical and procedural side kind of revved up, how do I kind of still maintain relationships with patients? How do I still have that same kind of interaction? And then the business acumen kind of side of me from the standpoint of kind of got an MBA and kind of growing kind of my side of that is saying, how do I scale that, right? Because we have a lot of the same conversations with patients. And so, can this turn into coursework, right? Is this kind of coaching specifically? I wrote a book that I'm getting kind of published. And this is a lot of stuff, but it is all stemming from the clinical setting. And I think we kind of safeguard a lot of that information when I think it's almost better to kind of give it out to our patients and then understand that we're there as a support structure for them.
Yeah. Well, I don't know where you have time to just be a human with all of the post-grad work that you've done and putting the book together. I'm glad you have, and hopefully you have some fun hobbies along the way that allow you to enjoy life as well. So I'm sure you do. There is a little bit of sarcasm that comes.
I do. I mean, I love basketball and I'm a big movie buff and I really do try. I think that's a huge part of even just from 3 pillars of health is, you got to practice what you preach, right? If you don't work out, if you don't take care of yourself, if you don't have good kind of mental health, if you're not happy, if you're not purpose, you're not driven, and then all of these things go hand in hand, family and friends and support, a community around you. I think all of that makes us, I know we talk about it as well, but I think when we look at optimizing someone's health, it's all the components of their life that make them optimal.
Yeah, I love it. Now, kind of maybe the approach you take, most people think about health and the practice about fixing problems, but you talk about health in more like building someone's health up or out. Can you explain the difference with me?
Yeah, I think fixing a problem is starting saying this person has a problem, and I have a magic wand. I can fix that problem for someone. I think it's a little bit too transparent or a little bit too simplified than what real health care matters. And, from a primary care background, you can say part of that's preventative medicine, right? Can I prevent a problem before it starts? But I would also argue that a lot of patients aren't empowered to take care of their health and take ownership of their life. And I think that's where a lot of these kind of problems stem, where inertia stops people from making changes in their health. That the status quo keeps them where they are. And the idea of change is scary for people. It's scary taking care of someone as someone who takes care of chronic pain. A lot of these interventions we do require psychological clearance. And we used to joke that was something that was more designed to insurance companies to deny procedures. But I think there's a real component about this where people's identity gets wrapped up in their pain. And a lot of experts, they get wrapped up in their health. And what happens is they don't see a path through it. And that path is scary, right? Because if the things that are not going well in your life, you can say is due to my back pain, and I fix your back pain, what's left? Right. And that's a very scary kind of idea for people. So we want to kind of get people in a situation and helping them. And this is where weight loss also comes into a huge component with this too, is saying your motivation to change has to be stronger than the status quo, right? Because change is very hard and it's scary. If I'm presenting someone with, let's say, an operation or a procedure, that's scary. There is side effects, there's complications. We're minimizing those risks, but we talk in terms of realities, right? We don't just kind of sugarcoat things for patients. But that idea of kind of staying where you are, you have to want to stay there versus make a change to move forward in improving your function and health and well-being.
Yeah. And that's probably where the mindset stuff comes in, because I don't want to say this is maybe how it worked for you or made that difference, but as you were from a family practice situation dealing with pain, you probably had people that were out of the pain and they didn't know what to do next because they were so focused on how that pain controlled their life. Yeah. But you're giving them, through your 3 pillars of health, ways out of that.
Mm-hmm. How do you take someone who hasn't been working and then kind of help them go back into the working world, right? That's really, really challenging. I see patients all the time that have been on disability, and most of them want to work, right? And so when you get out of that kind of cycle of kind of going to work or having that kind of outside of the home kind of purpose, right? So obviously taking care of my family and my wife and my children are really important to me as well. But patients are looking for community. And I think work is a huge part of that as well. Or just being able to give back to their specific communities, if that's their churches or societies or things like that are a part of, and they're limited, they need to find a path through that as well. So we're always kind of framing things and saying, what do you want, right? And how do I kind of get you there? And again, part of that is specific for that problem that I'm taking care of in the clinical setting, but part of that can say, hey, do we need to have specific time we're spending doing this coaching? Or do we want this for specific coursework? There's a million different ways to kind of help people. It's trying to find the right tool for the right person.
Yeah. You have a lot of tools in your toolbox from all of what you have. So I think that's, easy and a good thing for your patients and your clients moving forward. But from the 3 pillars of health and, what you have, which is mind, body, and purpose, why do you think it's important for all of them to work together?
Well, if we pick one at a time, right? We kind of pick out different parts. Let's use body because that's where we're starting from with this idea. If our body is kind of quote unquote falling apart, right? If we're dealing with chronic pain or chronic disease, for example, someone has diabetes, or I've got all these patients that I take care of, that have uncontrolled autoimmune disorders, right? And these things, if you can't sleep, if you can't move, you can't do anything, your stamina is going to be very, very poor, right? And then when we look at it from the mind itself, mental health is a huge component of this. And it doesn't have to be a formal diagnosis to someone who has depression or anxiety or bipolar disorder or something of that nature. It's just stress, right? Stress plays a huge role. And the idea of when we're looking at the mind, and you mentioned mindset is believing in the idea of change, right? That change is possible. Can I grow? Do I have the ability to make the changes in my life to then direct that towards purpose? Purpose and responsibility, I think, give people meaning in life. So the first kind of, so it's not really a triangle in terms of mind and body, and then purpose is at the top. They really do interact. But if the mind and the body aren't right, it's really hard to find your purpose and reach your potential. And just like if you don't have a purpose, and let's say you're dealing with chronic pain, for example, it's much, much harder to get out of that cycle. But if I help you find your purpose, it's much easier to kind of break through that. So it's more that they truly do kind of interact with each other. And then when they're all optimal, we're in the best position to succeed in life. And I really like things like high performance health. We can't say we do everything in this world, but it's the same general concept. How can I help someone reach their maximum potential in life?
Yeah. Do you feel, Dr. Dydyk, that some patients come in specifically to your practice with just the body issue, or they come in with the purpose issue or the mind issue, or like how do they enter into the 3 pillars of health realm with you?
That's a great question. I think there is a component. We do a lot of stuff. I mean, I do have folks who are more in this kind of sports medicine, orthopedic kind of side of this. And that's a smaller percentage of my practice. The reason why that is common things are common. Chronic pain is common. You see them, and I like complicated. And so I like complicated cases to take care of. You do have patients who come in specifically for the body, right? And we have patients who have clear goals and they see it as a bump in the road. I get really excited sometimes to see folks like that, because obviously if they get better, they're just kind of already on their path. I think the hardest folks to take care of who aren't optimized in any one of those pillars, right? If someone has, uncontrolled mental health and poor self-esteem, they have chronic disease and chronic pain, and they are lacking in purpose, that's a very difficult case to navigate through.
Yeah. Yeah. So how do people learn about how to get more information on 3 pillars of health? Like, do they come from your clinical practice? Is it people in your community? Like, how are people becoming more aware of 3 pillars of health?
So part of it's patients, for sure. Part of it's just kind of community in terms of my network. LinkedIn's great. I think that's really, really helpful to kind of help grow things from that standpoint. And then it's just kind of branching out more and more. One of the decisions I made earlier this year would be more actively involved with social media and trying to kind of not just network from a marketing standpoint, but just kind of have people understand kind of what you believe in. I think it's important to be genuine, obviously, and part of that is in saying, does this resonate with people? I think people want people who are out there who are trying to help them develop. I think people are eager for responsibility, believe it or not, even though they often don't act like it. And I think they want the tools to be able to develop.
Yeah. So let's say like the day in the life of Dr. Dydyk is you have your medical practice, and then you can have some of the 3 pillars of health. How does that day go for you?
Well, a big part of my day is clinical practice. Now I'm both a medical director in my practice, and I see patients. And so that's my primary job. I think one of the things that are always kind of hard is when you're developing a secondary business, right? I mean, this is the nights and weekends and bootstrapping kind of lifestyle of having your own second business. So you kind of fit it in wherever you can, honestly. I think that's, it's hard eventually when it comes to scale and growth. And, if we're all lucky enough to kind of get to that point where our dream and our vision is able to be our kind of primary kind of full-time, then that's maybe what happens long term. But for me, it's just finding time, right? You build a schedule. I've got block time, or I've got time off here, and that's where you build your schedule for time with clients. I also think there is part of this. I've been always interested in things like coursework. That's part of the reason why I've been writing a book, is the idea that we spend so much time having conversations with patients that would benefit someone else. And it's like the same exact conversation, or maybe you had a little bit more energy, or you had a cup of coffee earlier and you had lunch. And then the next person you saw, you were kind of a little bit out of gas by the time you're having that kind of same kind of conversation. And you want to be able to give that to people. And so even earlier on in my practice, I started doing things like webinars, right? Just how can I give you as much information that is just high quality information? It's just me talking to you, and patients like that, right? So then it's like, okay, like, how do we extend that? How do we kind of grow? How do we develop that into coursework, for example? Or I mean, I want patients to be able to just be like, oh, he's got a ton of videos out there that I can just watch and it can kind of help me. And so as kind of time goes, I see them kind of blend together in a lot of ways. There's the clinical side of it, and then there's everything else, right? It's like, is there a world where your physician is someone that, even if it's, in this kind of outside kind of community, that you feel like you know them? And then I wanted to be able to be something that extends beyond myself, right? When you start a business, patients, friends, people ask me saying, "It's you. How do you have all this time?" Right? And it's like, I don't. I'm not gonna lie, I don't. But I don't want it to be just me either, right? So I think that you can model behavior for other docs or other people in other industries, right? So I think it's great, but I think 3 Pillars of Health extends outside of that too. I think different kind of jobs and careers have different challenges to navigate, and I just know mine very, very well from being a physician.
Yeah. Do you think that there's a more of a hunger for something like the 3 Pillars of Health? And the reason I asked that, Dr. Dydyk, is because I can go to see my family practice doctor and I can go and talk to him or her, and I get 7, 10, 12, maybe 15 minutes of it if I'm lucky. I think the general population is turning to the point that if I'm going to get better in my healthcare, I've got to find somebody that can spend more time with me.
You asked another really good question, Derek. And I almost look at it in other industries as well, where, we live in an age now where information is at your fingertips. Okay. In the dawn of AI and just how quickly you can get, patients are very smart. They can find information. Okay. And so the idea that we're safeguarding and hiding information isn't the way forward in medicine. The way forward in medicine is being a support structure. A way forward is you are the most prime person, personally, as a physician, to help kind of guide people through life and be their confidant, be their coach in a lot of ways. And you have the skill set and the training for that to be legitimate as well.
Mm-hmm. That makes me think of, not everybody likes to go to a dentist because of the needle going up to their mouth. Not everybody likes to go to the doctor because they sometimes don't want to hear the bad news that's out there. So when somebody comes into the 3 Pillars of Health, how do you build trust with them to make sure that they know you are on their side? I know you listen, but that you're on their side for their, next steps with you in healthcare.
I think honesty and integrity always come into a huge role of this too. So you do want to have candor. I mean, you want to have emotional intelligence to be able to talk to someone to meet them on their level. I think that's really kind of critical when we're having conversations. But one thing that's really good as a physician is if you've seen enough patients, you learn how to take someone from being a stranger 1 minute, and then by the end of a 20-minute encounter, they feel like they can trust you, right? Yeah. And developing that trust and rapport is what I do for a living. I wrote an article, a couple of months ago, that's saying that, as a member of, as a physician, my job is customer service in a lot of ways. There's a lot of overlap between those industries, and that's not to diminish, in the service industry, it doesn't diminish being a physician. It's that I'm looking at patients a lot like customers, from the standpoint of how does this affect their experience? What are you trying to get out of this as well in this interaction? I think one of the things that kind of moved me from primary care into specialty was I had some challenges, honestly, early on, kind of having conversations with folks about things they didn't want to talk about. When a patient comes in and they want to talk about their back pain, and you want to talk to them about problems 1, A, B, C, D, and that's, the 5th or 6th things down on the list, the patients, a lot of times, you definitely are helping them with their health. Don't get me wrong. But the patient's experience a lot of times is saying, "Hey, you didn't even talk to me about my back," right? And so that kind of shifted my focus, where I work with a lot of primary care doctors in our practice. And part of that is I wanted to be a support structure for them as well, so that we can say, okay, you send patients to us and we're going to optimize them, we're going to get them healthy, and it's going to be a lot easier to get their diabetes and blood pressure under control. And I do think we see that quite a lot.
Yeah, when you take the time to listen to them, are able to hear their, not necessarily complaints, but what's taking place in their life, and they don't know how to express that sometimes, I think, because of the time constraints that were there. Mm-hmm. An example of that is my first job I'm a chiropractor. My first job out was actually for an orthopedic surgeon running a rehab department for him in Ravenswood Hospital in Chicago. And he would come in, he's a very good doctor, and I won't say his name, but he would come in and he would talk so fast with the patients, and he would be out the door, transcribing his notes in the phone back in the day. And the patients are like, well, I didn't get to ask him this. So I would say, well, let's do this little bit of a test. The next time you come to see him, get off the table and stand in front of the door and don't let him leave until your questions are answered. He started to catch on. He goes, Derek, what's going on with these patients? I said, I don't know. I think they're just concerned. So I think that when a physician like yourself has so much background that you understand there's more to this, the SOP that we go through from a note perspective, it truly is what the patient needs. And when you take that time and address 3 pillars of health, and everything else that you do is only going to give them better outcomes.
I completely agree. Patients are the most interesting part of my job, right? So I love people, I love patients, and I love helping people. I think part of that too, when I created 3 pillars of health, not everyone's going to be suffering from chronic pain, right? And so I spent a lot of time talking today from the clinical side, because that's where I'm building this from. That's my base, right? But there's a lot of patients who don't suffer from, let's say, mental health, or they have, let's say, a mindset that things can change, but they don't have a path forward. They don't know how to reach those goals. And so I think there's a huge component of people in this world who need help with purpose. And I think purpose, even outside of my role initially as a physician and now kind of building my own company, I think that's a huge part of me. Yes, self-help is a giant industry, and I understand that. But I think there's also the way people talk to people and those interactions that you have. You can bring that same kind of interaction that you have in an optimized clinical setting as the physician to someone who needs help, let's say, with purpose. They're trying to achieve something in their career as well. And so I don't like to pick and choose what I talk about with patients from the standpoint of why are they here? What did they want to talk about? And that kind of helps us kind of gear the conversation.
Yeah. So as the people are listening and they're like saying, oh, Dr. Dydyk is saying, and it's speaking to me, but can you kind of differentiate who you feel you can help versus who you feel you can't?
That's really good questions, Derek. I think we always want to know what we know and what we don't know. Okay. And yes, I've got a pretty kind of broad kind of background. One thing I started developing when I came out of training, I've been in practice now for about 4 years, was I got my MBA coming out and been spending a lot of times in terms of kind of building kind of physician kind of leadership and leadership skill set, because I see that as almost like a missing kind of component to it as well, where, everyone has different goals, but I started shifting a little bit more towards high performance health as well too, because I want to help people who are maybe already kind of more or less starting to get optimized, right? And part of the reason why I did a sports medicine fellowship was taking someone who is at the pinnacle of their powers, essentially, in terms of physical health, and helping them achieve more, or getting them back up to that level. It's not getting someone off the couch and be able to walk around. It's being able to someone to do a 40-yard dash in under 6 seconds, something like that. That's the kind of difference that you can kind of take from the different patient populations or different clients that you take over. I mean, you can have a conversation with someone who's in college who doesn't know what they want to do with the rest of their life, or you can have an executive that you're having a conversation with and they are trying to help their company kind of grow and succeed. I look at that kind of conversation as very similar to how I see different patients, and I don't cherry pick patients. It's coming through. I like the variety from that standpoint as well. I don't pretend that I have every single answer either, but I am someone who will say, let's find the answer together.
Yeah. You're a human. We're not supposed to have all the answers. We like them. And most of our patients think that we do, but it's okay if we don't. And it's okay to say, you know what, I'm not sure about that. Let me get back to you on it.
Absolutely.
Too often we try and be perfect. And in practice, it's hard to be. Now, granted, when you're doing surgery, you need to be pretty damn close to perfect. I understand that. I'm sure you are. But when it comes to these conversations, whether it's passion, purpose, mindset, all those kinds of things, we have to get close. We've got to massage ourselves into a better me from the inside out. And I'm sure that you do that for every single one of your patients you see.
It is the practice of medicine, right? I mean, that's what they say. That's an art form, as much as it is a science. And I like the art form. And I think that's where you kind of extend beyond it. You're saying, okay, what else do I do with this, right? So how do I help people in my communities?
Yeah.
And then if you're taking on that responsibility, it gives you a lot of tremendous self-worth, both as the person who's helping someone, but it helps people develop that and see that that helps them find their purpose in life as well.
hmm Which gives you a little bit of an ego boost, not that you're better, but it says, you know what I'm doing is right. I'm helping more people, which is
I
good.
always joke, if you can look in the mirror every morning and smile, and if you can put your head down on the pillow and fall right asleep, and that's a pretty good place to be when you don't have any regrets.
Yeah, that's a good day. That's a good day.
Yeah.
From the three pillars of health, what's your focus on right now in the business?
My focus on right now in the business, I'm kind of working on a course right now, weight loss coursework that's really important. Finishing, kind of getting my book kind of published that I also wrote. That was also our first one, was for weight loss, because as my pain practice really kind of revved up, my weight loss side of it kind of started kind of shrinking because there's only so much time in the day. And then the next kind of focus with that too is kind of building more of the speaking kind of side of it. I think that's really, really important, is having these kind of group interactions. I think that's, I think the interaction between various people and being able to ask questions and kind of play off the audience, I think is really important. I see a lot of that developing too.
Yeah. Well, I think one of the constraints you have is time. You've
Always.
mentioned that yeah, it's a difficult thing. We only have so many hours on the calendar in the day and in the month and the week and what we go through. But I guess I'd ask, what do you feel is your biggest challenge right now with the three pillars of health?
I think scale is always going to be a challenge, right? I think when you're one person, I think, and you have kind of support structures with other folks, and you're growing it from that standpoint, you're saying, how do I bring in other providers who want to kind of build content, right? I think that's a really important thing as well. How do you kind of explain to them that this can be their platform as well, right? So I think that's always a problem of scale in a lot of ways. Is going to say, okay, now we're outside of just the initial kind of vision. How do we kind of grow together, if you will, as we kind of incorporate more folks into the organization?
Yeah. From the business side, I will ask, because AI is coming, whether we like it or not, as I said, kind of in there. How are you implementing AI into your business?
I think AI is great. If the more you use it in a lot of ways, the better it kind of gets from that standpoint, where you get more comfortable using it. I think that the challenge that I see, especially if you're someone who does kind of content and you kind of talk, is not to sound robotic, right? So you want to make sure that you're creating your own kind of content. I think it's great for brainstorming. I think it's great for a lot of to expedite getting information, as long as you're making sure that those kind of references are being cleared and making sure they're correct as well. I think it's great. I think that's part of the reason why I decided to launch things when I did, because I saw a path that allowed me, with a busy schedule, to start growing a business at that point.
Mm-hmm.
And before, I don't know if I did see it. I think there's a lot of things that kind of go into kind of building a business beyond kind of, just having a website up and having all the legality. It's how do you kind of interact? How do you grow? How do you find more clients? I think that's really challenging, and it takes time. And so you have to have that separate time commitment beyond putting time into your actual business. You almost got to separate the two in a lot of ways. I think that AI really can help you a lot with that.
Yeah. I want to jump back to the success you have with your patients and see if you could share a story that you have from three pillars of health, or how you've dealt with patients over time, kind of taking them through that, and what successes they've had.
Success comes in various forms. I think one of my favorite patients that I've taken care of longitudinally is someone who I've seen for weight loss. I've seen someone who suffers from very, very severe degenerative hip arthritis, and he'd be an excellent candidate for hip replacement, but his initial starting weight was about 475 pounds. Okay. Very, very challenging, monitoring, taking care of him with medications and injections. I mean, if you imagine how challenging it is even doing a hip injection with someone with that kind of level of habitus. And so we made it a real kind of goal a few years back that we were going to help him lose that weight, right? And this is someone who's kind of lived this way for quite some time. And part of that is having realistic expectations, how long this is going to take and what this is going to look like. And I've been taking care of this gentleman for 2.5 years, both from a outside coaching kind of side of this, as well as just the medical practice side of this. And he's lost close to 200 pounds in multiple years now. And he's now his hip pain is better. It's not great, but it's much better than it was. But now he's in the realm where he's a candidate for surgery, which is the whole goal. We didn't want him to be without any options kind of moving forward. where that hip has deteriorated so much that he can't even get it fixed at this time. And so you take those kind of lessons with you, take lessons from patients that you care for, where I'm someone who does intrathecal pain pumps, which is basically pain pumps that go underneath someone's skin. It's a port that I install underneath someone's skin to have micro dosing of pain medications, itty bitty doses of things like morphine. But these doses are so small that there really isn't much of a side effect profile and a fear from that standpoint. But we're not doing that on anyone. We're doing that with patients who have very severe pain, patients who've got fusions from kind of head to toe, or have tried so many other options. And part of that conversation is a lot of what we've talked about right now, where how do I help someone believe that there's a path of getting better? One thing we haven't talked about today is a lot of my job is to kind of help people find hope, find a path moving forward. And so we do these pumps, and this part of my practice is continuing to grow. And it's a complete 180 on their lifestyle. You take someone who's got, walks around daily at a 9 out of 10, and now their pain is much more manageable, and they're a 2, and they're able 2 out of 10, and now they're able to kind of navigate and do all their activities of daily living. And so once you kind of break that cycle of pain, again, if I've helped the body, now it's easier for me to kind of start focusing my attention on some of those other pillars, like helping people kind of find their purpose.
Yeah. It makes me think that this is a big missing part of healthcare. And what I mean by that is there are a bunch of other individuals out there that are providing pain medicine. And I don't want to discredit anything that they do. You've done anybody in that, and like, that's not what this is about. It's that there's more to it than just you prescribing or you setting in the ports or doing that. It's what happens when they get better. And I think that maybe other providers, they're done with it at that point in time. You're giving now your patient, you hear how they're better. They're telling you, I'm not, instead of a 7, 8, 9, 10 out of 10, I'm down to a 5, a 4, a 3. And now they can open up more conversation, and they can say, okay, now that I'm out of this, can you help me change the next aspect of my life?
And maybe they don't need to see you in that clinical setting anymore. I think that's also a huge part of this as well, where, again, what do you view your role as their provider, right? What does that mean to someone? Everyone's different, right? I know what it means to me. It means that, again, I'm their kind of support structure. I mean, I treat patients like they're part of my family, even though I've got thousands of them. And that's just how I am, right? I want that, because I want that kind of responsibility. Yes, you have to protect yourself. You got to protect your time. You got to make sure that you're not getting too attached from that standpoint, because you can't kind of control everything, obviously. But at the same time, if you keep too much of a distance and you don't get to see your outcomes and you don't invest in your patients, it can get kind of monotonous otherwise, and you don't see it, and becomes more of a job than a calling.
Yeah. Well, this has been a jam-packed podcast so far. I appreciate the information you're sharing, and I'm sure we're going to have to do another one down the road, because I don't want to shortcut anything you do. But if people are interested in learning more about you, we'll share all of your links in the description below. But how would you like them to be able to reach out to you and learn more?
You can always reach out to me at 3pillarsofhealth.com, as well as find me on LinkedIn, Dr. Dydyk. I'm always on there every single day. Kind of growing some of the other aspects of this, like Twitter and YouTube, and that's going to continue to grow. But the website's the easiest way to kind of contact me, surely.
Perfect. So as a healthcare professional, if you could give us just one piece of advice that would change everyone's health in a positive way, what would that be?
Starting now and not waiting for later. I think that's one of the hardest things for people to do is getting off, the couch and start moving, both in the aspects of their physical health, but their mental health, and finding their purpose. I think the most remarkable thing about being a human being is you can change your mindset immediately. It's just being able to kind of do it.
Yeah, it's true. I was told by somebody when thinking about mindset, they're like, you can't let other people get you down. And that's a tough one when somebody says something negative to you. If you're talking about that 400+ pound patient, somebody says something detrimental to them about their physique, that has to be difficult. But, this person said, it's just like turning a switch on or off. You have the control of the hand going up to it. But I think what you help people do is find a comfortable way to get to the light switch, to turn that on and off and say, okay, I do need to make a change on what's happening. But I love how you explain that health tip. So I can't wait to re-listen to this myself to take that advantage for myself as well.
Thank you, Dydyk. I really do appreciate that.
Absolutely. My pleasure, Dr. Dydyk. Last question for you here is that you've been a great guest on the Prime Health podcast. What would your definition of Prime Health be?
Prime health is the optimization of your health. Okay, so we talk a lot about mind, body, and purpose. I think there's a lot of that overlaps with it. I really do when I think of the prime aspects of someone's health. But we also look at this stepping a step beyond that too, is where is our kind of community, right? That's part of having prime health. Where is our life plan? I think that's part of having kind of prime health, where when we talk about having someone optimal health, we're talking about often having a good life, right? And having a good life is different for everyone, right? Not everyone's married with kids, but I wouldn't take mine away ever. And that's part of kind of optimizing my health, right? Mm-hmm. And having a prime health for me as well. But people get so much out of their community. I've got a friend of mine who helps dogs, in dog charity, dogs, humane society. And that gives them purpose in life. And I think that that's really important for them to have a prime version of their health. And all the other components go into it as well when we talk about our mindset, when we talk about our body, we talk about our purpose. So I think there's a huge overlap between prime health and the three pillars.
Yeah, well, it's great. There is an overlap, but it's so pertinent for it. I mean, there's prime health in each of those positions that's there. And it's very true. You can give the definition of prime health. I can give it, but it is really unique. Just like success, what is our definition of success and how we do it? And I shouldn't judge myself if I don't meet your qualification or your definition of prime health or success. We have to be kind to ourselves every once in a while.
We do. I mean, we didn't spend time talking about it today, but I think part of that's happiness, right? When we talk about the pursuit of happiness, I think there's a huge part of that overlaps with purpose, but also just the things that we enjoy in life, right? So what gives us kind of truly kind of happiness in life and allows us to not just achieve, but be able to go through the world with empathy and kindness to be the best human being that we can be.
Yeah, absolutely. Well, Dr. Dydyk, it's been a pleasure to have you as a guest. You've got a very unique perspective and approach to what you're doing. I can't wait to kind of see how that, adventure continues on for you. What I don't think people understand is you have so many skill sets, different hats, things that you've learned as to how it can help them with the three pillars of health. And whether it's one aspect of their health or you get better with that and then it goes on to the next and the next and the next. There's so much overlap that can take place. It's not just fixing one thing. It's once we're done with that, what's the next step we can take? So, you offer a full spectrum of improving patients from a healthcare perspective. So I appreciate that. And I always say this from our viewers and listeners' perspective. Dr. Dydyk shared a lot. But if there's one piece that, one person could take advantage of, I would ask you to share this to that one person. We, of course, would love you to share it with many people as possible. But if you can help one person at a time with what you know, that would be helpful. Whether it's Dr. Dydyk that helps them or a physician in their own area, it doesn't matter. We just want people to feel better. And as you said there at the end, we want them to be happier in what they're doing. So it's important for that. And then I always ask selfishly, please, we'd love to get more subscribers on our podcast. We love to be able to help with the great guests that we bring on here. So until next time, remember that true wellness is a journey we are all on together. Now, whether you're taking charge of your own health or someone else's, getting them better and every step forward matters. So I do say, please do stay committed to your Prime Health journey. And Dr. Dydyk, again, thank you very much for being a guest on the Prime Health podcast.
Thank you so much, Dydyk. I really do appreciate it. Have a wonderful evening.